my own condolences on the passing of our chairperson of the Select Committee for Social Services, Honorable Marantia Gillion, an honorable member and comrade who I've also come to know over a number of years, over my deployment by the party and organization which both of us belong to. Over a number of years, I've been deployed by the ANC in the Western Cape, and I've come to know her over many years in that capacity. May her soul rest in peace. Honorable members, I'm here with the Deputy Minister, Dr. Sibongiseni Dhlomo, who you also know very well, having been previous chair of the National Assembly Portfolio Committee, and he's been on this platform in this capacity as Deputy Minister a number of times. From the administration side, the team is led by the Director General. When he comes in, he'll also introduce the team. We take cognizance of the time allocation, so I'm going to do opening remarks, and I want to also just appeal to the DG and his team that they should be cognizant of the time allocated and not go too elaborate while covering the subject matter. As a matter of introduction from my side, Honorable Chair and members, I want to just remind the committee that the 2021-22 financial year on which we are reporting was really the year dominated by the COVID-19 pandemic, which started first case here in South Africa, confirmed on the 5th of March. So a few days ago, we are commemorating 3 full years of the COVID-19 pandemic. Having started beginning January of 2020, the 2021-22 was a year fully occupied in terms of financial year by the pandemic. We are aware that we only lifted restrictions after the end of the financial year in June last year. So this year was fully within the pandemic at the very high level, with about 3 waves within this financial year. Now, in that period, as we were focusing, a lot of resources were redirected to fight the pandemic. That is financial resources, human resources, in terms of mitigating against the impact of the pandemic, saving lives, providing mitigation, but also later on, once vaccines became available, also focusing on the mitigation of severity of the disease through vaccination program, which also took a lot of financial, human resources, and also other material resources. Also, unfortunately for us, administratively, it became a year of quite instability, this particular financial year. It is in this financial year that our former colleague, former Minister Mkhize, stepped down, and then for quite some period, there was an acting minister, and then I was appointed in August of 2021. So in this period, we had 2 ministers and 1 acting. And also because of issues relating to some of the allegations and complications, also the DG was away for some time to answer to a number of issues. And we had to have an acting DG. Our CFO also left for other opportunities. And we had 2 acting CFOs, and we currently now have a full-time chief financial officer. And also the instability in terms of other complications of relocation, because of complications with our previous headquarters, with a lot of workers not coming to work, a lot of conflict with the unions, specifically related to safety issues with our building. We do then just touch on the reminder in terms of the level of, especially on the vaccination, trying to save lives. And the reason why we reflect on this, and I will not go into details, Honorable Chair and members, to save time, is just to indicate that we had to set up machinery once we got access to vaccinations after a lot of attempts and moving a lot of, moving big obstacles with the assistance also of our president. Were able to access vaccines and then had to set up the machinery of something which had never been done in the history of our country. You can only maybe equate it to the mass rollout of testing for HIV in 2011. But even then, the testing for HIV, the mass rollout of that was over a prolonged period, whereas the vaccination had to be pushed within a very short period of time to try and save as many lives. And this was across, various age groups. Usually vaccination is for children, but in this case, once we were able to access vaccines, which were very scarce, and we had to negotiate with Treasury to find ways in which we could adjust our procurement processes so that we could access these vaccines under the very good supervision also of the National Treasury and the Auditor General. It's important just to indicate this, setting up a new machinery in terms of the vaccination data system, which is wholly state-owned, owned by the department, together with assistance of the Council for Scientific and Industrial Research, the CSIR, using also collaboration between the public and the private sector, one of the major innovations in this regard. Setting up no fault vaccination adverse effects scheme as a requirement by many of the companies which sold us the vaccines. So, and working with a process whereby members of the public could be vaccinated either in public sites or in private sites, and whether they were covered by medical schemes or not. So this was really a very testing time. I'm raising this because, as you would see, when we come to the Auditor General's report, as a result of this complex issues when we submitted our information, especially relating to reimbursement of for us claiming reimbursement by those who are medically insured, who are insured by medical schemes. There were a number of complications, as honorable members are aware, that when service providers submit claims to medical schemes, it's not always that for all those claims, medical schemes are going to agree to pay for all the claims. We also then came across this, and that is a matter which then resulted, unfortunately, Honorable Chair, as you're looking for cheerful information, although this was very innovative and saved many lives, for the fact that we're able, in terms of adults, we're able to reach at least with one dose of vaccination for adult populations above 18 years and above. We're able to reach up to 70% with about just over 50% of adults with about 51% with at least one dose, but the over 60s were able to reach more than 70% of the over 60s with this vaccination. And that's why, since we lifted the restrictions, we never experienced any flare-up of serious illness of COVID. But notwithstanding these achievements, when it came to the fact that we could not be able to get all the money we're claiming from medical schemes, this was an adverse finding from the Auditor General, as the team will show. So I'm just giving this background, especially on the vaccination, the good achievement, but at the same time, the fact that on the Auditor General's view was that because we projected certain income from the medical schemes claims, and we're not able to get all that money, this has resulted in an adverse finding of a qualified audit. On that note, Chair, let me give over to Director General to then go into the actual substance of the actual annual report. DG, I give over to you with the permission of the Chair. Thank you.
Thank you very much, Honorable Minister. Thank you very much, and good afternoon to the Honorable Chair, Honorable members, the Deputy Minister, and all the colleagues from the Department of Health. We will be presenting the annual report as the Minister has clearly put forward. And of course, the Minister did mention the unfortunate part of the report. But I am joined by a number of Deputy Director Generals and Chief Directors who are here with us to be able to respond to the questions. To manage time, I will not be in a position to introduce all of them, but during the question time, I will introduce them if they have to deal with specific questions. With the authority of the Minister, may I request our head of M&E to actually present the actual report together with the Chief Finance Officer on the finances. Over to you, Thuli.
Let me just remind our Chief Director that she has, according to the allocated time, I think only about 45 minutes, 40 minutes maybe it looks like at the most. If she could take even less than that, maybe together with the financial side, all of them together, and maybe if you could not take more than 40 minutes so that the honorable members can then interrogate the report. Over to you.
Thank you, Honorable Minister. Thank you to the Honorable Chairperson, the DG, and Honorable members. I'm going to just share maybe show up first, and then I will share my host only. Who can share? I'm just trying to share my screen. Okay. It's just configured differently as it's asking me who can share. I'm clicking host here.
I think Andre maybe should make you co-host.
Marcel,
Okay.
can you make a co-host? Maybe it will make things easier.
And I have made Ms. Dondia co-host. I've made quite a few of the department's colleagues co-hosts. Thank you, Chair.
Oh, great.
Thank you. Let me make sure that my presentation is visible. Okay. Is my presentation visible yet? Is my presentation visible?
Yes, I think it's
visible
okay now.
indeed. It is
Okay.
visible.
Thank you, thank you, Chair. Thank you, Honorable Minister. So I'm gonna go very fast. Thank you, Minister, for highlighting the time factor, as we had a lot of slides. So this part of the report highlights the performance, and then the CFO will cover the financials. So I'm gonna skip the generic slides of the purpose and also the well-known vision and the mission of the Department of Health. So, but to just emphasize the fact that the department is deriving its vision and mandate from the NDP 2030, and we're working towards this. And every year we make sure that the APP is aligned with the NDP, the compact, as well as the National Strategic Plan and the medium-term strategic framework. Okay, so in terms of the performance information, we've got 6 budget programs. So I'm going to start with the first one, administration. And for the first one, talks to the audit outcome of the National Department of Health. Minister has already indicated that we have gotten a qualified audit for 21-22, and the later presentation by the CFO is going to provide a little more details. And then the second indicator talks to the policy and legal framework to manage medical legal claims in South Africa. And there has been delays in terms of this deliverable. However, there is work that has been done by the South African Law Reform Commission, which will form the basis for the bill moving forward. And then for the case management system to manage the medical legal claims, we had a target of 7 provinces, and we only managed to reach 4. The others are still working on the integration of the system into their existing system. And then the when it comes to the health promotion messages that were supposed to be broadcasted on social media, we had a target of 100, but we exceeded this because we got 443. This is due to a lot of communication that was required for COVID-19 in addition to the normal communication that we would have done for our various programs. And we also have indicated actions that we need to take to address this. So with regards to case management system, we are engaging the provinces and also the service providers that are continuing to assist the department in managing the medical legal cases, and the work of the South African Law Reform Commission would be fast-tracked as we go forward. Coming to program 2, the first issue deals with the National Health Insurance Bill. The members would be aware of the process that involves the public hearings and the clause-by-clause discussions that have been underway. And then we had a target to actually register the medical aid beneficiaries on our health patient registration system. However, there has been some delays because of the citing of the POPI Act by the medical aid. This is being attended to going forward. And then when it comes to the service benefits framework for primary health care, just to say that this was developed, however, the approval will be fast-tracked going forward as it was delayed due to urgent matters of COVID-19. We have exceeded our targets when it comes to the clients that have been enrolled on our CCMDD program, which is the one that is dispensing chronic medication. And also we've exceeded our targets when it comes to the number of facilities that are reporting stock availability at our National Surveillance Center. This has to do with our medication, ensuring that it's available and it's accessible when needed. So this shows a breakdown of the patients that are currently registered through the CCMDD system, and with the mega provinces such as your KZN with about 1.6 million, followed by Gauteng. You will see that the mega province is actually leading in terms of expanding this program. And then we have got the total number of health facilities reporting stock availability to the National Surveillance Center. And you will see that we have almost all our facilities covered. And also we have got additional pharmaceutical deep storage sites such as your depots, pharmacies, dispensing units, contracted GPs, and others that are also that ensure that we can exceed our target. So we await the process for the National Health Insurance Bill in Parliament, and also participating in these processes, and prioritizing the primary health care benefits framework for this financial year, and also working with legal advice in terms of ensuring that private patients are registered on the HPRS. Coming to program 3, and so we had a target of about 14 million people vaccinated against COVID. We achieved just above 20 million. And this was partly due to poor uptake, particularly by the younger groups. And we implemented intervention strategies such as Get Ready campaign. And with the youth zones to address the HIV and sexual and reproductive health, we had a target of 1,600 and we achieved 1,264. And the challenges that were to do with the reporting have been attended to in this financial year. And this slide shows the numbers of vaccinations, alluding to the overall that Minister cited, and just showing the various province electronic delivery systems. And we also had a target of 75 state patients admitted to designated psychiatric hospitals, and we're able to have 290 of those. So there is improvement and a better uptake of the program. And then when it comes to the medical officers and professional nurses trained to improve their skills on clinical management of mental disorders, we had a target of 500, we achieved 510, so we've delivered on that. We've also delivered on the hospitals that obtain 95% and above on food service policy assessment tool. And we have also been able to deliver on the maternal care and neonatal care guidelines that were approved. So I've indicated the intervention strategy for this program, so I can move to the next budget program, which is program 4, primary health care. So with this program, we had a target of 100 primary healthcare facilities and 80 hospitals implementing National Quality Improvement Plan. And what was achieved was 90 primary healthcare facilities and exceeded the hospital number. And also we added the EMS the EMS sites. So, but what was key here, even though we did not fully achieve the primary healthcare, we had more hospitals, and also we're able to add more EMS to the program. In terms of the ideal clinic, we had a target of about 2,100 and we achieved 1,928, partly because of the fact that the resources were diverted to COVID-19, and for facilities to qualify, they needed to be able to purchase certain items such as the equipment. And then this slide shows the breakdown in various provinces for the ideal clinic, showing that Gauteng is still leading at 92%, followed by KZN. And I think the provinces that are at the bottom would be the Northern Cape and the Eastern Cape, who are currently still struggling with their coverage. And then when it comes to the policy and implementation guidelines on traditional medicine, we were able to present this to EXCO. However, the implementation could not happen due to the delays in finalizing the policy itself. So it will be fast track going forward. And we were able to achieve the target of all provinces complying with emergency medical services regulations. We're also able to achieve the target of the 18 ports of entry compliant with international health regulations. Also the one for the metropolitan and district municipalities that performed 60% and above in terms of compliance with national environmental health norms and standards. So we exceeded that by 1. So this slide just shows and reflect the names of the ports of entry that are currently compliant with international health regulations. And I think this is quite key for traveling past our borders and to other countries. So we'll not go through the details. I will skip this and then go to the one that talks to the clinics testing the guideline for measuring effectiveness of clinic committees. We had a target of 200 and we were able to exceed that. Also, when it comes to the number of clients that were followed up by the community health workers that were lost to treatment, we had a target of 250 and we achieved 509. And then also, we were able to exceed the targets on the number of primary healthcare facilities with ward-based outreach teams. Here we show the numbers per province in terms of the patients that were traced by the community health workers. I will go further. And also here we are indicating the actions that will be taken, that were taken in 2022 to address the challenges that where we did not perform well. And then let me move to program 5. In terms of the hospital systems, we have achieved all the targets that were for facilities that needed to be constructed, revitalized, both primary health care and hospitals. The figures are shown. Moving to program 6. So in terms of program 6, we have been able to achieve the 9 public nursing colleges supported to achieve accreditation for basic and specialist nursing and midwifery programs. We were able to deliver on 8 of the 9 provinces supported to develop implementation plan for strengthening clinical governance. When it comes to the community service policy, the presentation was made to the NAC. However, there was a decision to actually relook at the policy formal review, so that actually delayed the policy publication, but the work is undergoing. And when it comes to our students allocated to health facility for community service, we are pleased to say that all our students could be allocated in this financial year. When it comes to the COVID sites, we had originally, with very little information we thought that maybe we'll have 500 COVID-19 sites, but as the implementation went on, we realized that we needed to make sure that this service is available and accessible across the country, so covering all our facilities. And so there was work that was planned for information system on TB and HIV. And this work is being paused, but it is being harmonized into the existing systems in the department. And we had a target to actually revise health research priorities, which we have achieved. And in terms of the actions to address the challenges, we are working with the Limpopo province to raise that the nursing directorate, or at least allocate dedicated professionals. And the review is being prioritized for the community service policy, and the work is continuing on the information system. So in terms of the overall summary for the department, we are sitting at about 62% of the targets that we achieved. Others we could do a whole lot of work, but maybe not all of the others could not be finalized. So I'll just go to one more slide on the human resources to indicate that in terms of the number of posts we have on the staff establishment is 1,696. And the current vacancy rate is sitting at about 16.9, which is pretty high, and is also related to the budget cuts that we have been experiencing. Let me stop there and allow the CFO to take us through the financial management section. CFO.
Yeah, thanks, Julie. Afternoon, Honorable Chair and members, Honorable Minister and Deputy Minister and the colleagues. I think I'll indicate so that we can move on the slides.
Okay.
Can we go to the next slide? On the next slide, we indicating the expenditure in the department. We also including such expenditure in terms of the programs, which you'll see we have 6 programs, starting from the administration, NHI, up to the last program, which really has already presented the performance information. So in terms of the overall spending in the department, we had 65.9 billion, which we have managed to spend 65.1 billion, which translated to 98.8%. Therefore, you will see that the funds which were available and spent was only 771 million. In terms of the programs, which they had the lower spending, in terms of this, it was the administration, which is support program, and also the NHI, which was also sitting on 81.7%. The next slide, we indicating the same expenditure in terms of economic classification. If you move to the next slide. So in terms of compensation of employees, you'll see that the spending was sitting on 95%. And in terms of goods and services, out of 9.5 billion, we managed to spend 9.1 billion, which was 95.5%. And in terms of transfers, as a national department, therefore, we have managed to transfer all the monies to the provinces, to the entities and the NPOs that they're supported by the department. So that's the total of 54 billion. And in terms of capital, therefore, we have spent 69.5%. And there, the reasons were mainly because of the slow implementation of projects by the contractors. The next slide, Chair, maybe because of time, I also want to go through the programs one by one, but we have indicated in terms of program 1 and also the sub-programs which we're having, and also in terms of program 2 in the NHI, also in terms of those sub-program, in terms of the spending, but in terms of the overall spending, you will realize that it's the same as the overall slide which I have presented. With your permission, Chair, then I'll move to the sector conditional grant slide, which is slide 61. On this slide, we also indicate the spending. I did indicate the 54 billion, which was transferred in subsidies. So this 52 billion, it only relates to the monies which were transferred to the provinces. Therefore, it will exclude the entities and the NPOs. So the overall spending in terms of the direct grants, it was 95%. Out of the 52 billion, we managed to spend 50 billion, and there was a 2.6 billion unspent. Then in terms of the NTSG, we have managed to spend our 95% in terms of the HIV, TB, caused malaria, and HPV, which we also indicated each sub-component of those grants, but the overall spending was 95.5%, which we also included the COVID-19 component, which we're sitting on 81.4%. On the oncology services component, we were sitting on 77.3%, and also on mental health, 65.5%, and also on the REVITE, it was 90.5%. And on the HR, so HR will realize that it's only finding the employment of the COMSEV and others, and also the training. Hence, you'll see the spending there, it's a high, sitting on 98.8% compared to the other direct grants. On the next slide is the narrative, Chair. It just indicates what I've been indicating on the previous slide. Then when we move in terms of the provinces, I'll only indicate in terms of the provinces where they are underspending in terms of the grants compared to others, but not going in details, because that overall, it also does cover all the expenditure. So in terms of that expenditure, which I just presented earlier, you'll see that the province which was slow spending compared to our others was Gauteng, sitting on 87.6%. And we also have in the KZN on the overall spending of 100%. And others, they were also doing well above 90%, but the expectation was the 100% spending in terms of these grants. So just going one by one, Chair, I'll just try to go as I have indicated, just indicating those provinces with the lower spending. As we have seen under the overall slide, Gauteng was the lowest. So in terms of the NTSG, we also realized they were spending 89.3%. But I'll also indicate the slide where we indicated the rollovers, which the provinces, therefore, they've requested and approved. In terms of the National Health Insurance Grant, which is the next slide. Maybe as I go, you just go with me on the slides. On the NHI grant, most of the provinces, they were spending 100%, which is good, except Gauteng, of course, sitting on 92.7%. But the overall available funds were 4.3 million. In terms of the Revite, on the Revite, we were having the Free State sitting on 69.8%. We were also having the Limpopo sitting on 87.5%, and also Northwest sitting on 70%. So others, they've managed to spend above 90% in terms of this grant. We'll also indicate some of the underspending, I mean, the rollovers which they've been requested in terms of the Revite. The statutory training, the performance you'll see is 98.8%. Most provinces were sitting on 100%. So except Gauteng on 96%. In terms of HIV, TB, cause malaria and HPV, which I indicated 95.9%. So the lowest spending in terms of the provinces, we're only looking at Gauteng, which I think it does dominate in terms of the other grants when we indicate some of the underspending. So Chair, because I've been indicating the issue of rollovers as I was going through the grants individually, so I'll also just request to move the slide as I'm also moving. So out of the 2.6 billion, which I indicated earlier on the overall spending on the conditional grants to have been underspent, the 1.4, we have managed to get the approval on the rollovers, which we have indicated in terms of the provinces, which you will see check on the left, Eastern Cape, where they received 60 million in terms of HIV grant. On top, we're also indicating the kind of the grants which we have received, therefore the rollovers. Then it comes to a total of 1.4 billion. Then there were no rollovers for KZN, MP, and Northern Cape in that regard. When we move to the next slide is the indirect grant overview, which are the grants sitting at the national office. So in terms of the budget, which was initially allocated of 2.1 billion, and during adjustment, just for the chair to note that therefore there was a national adjustment, and then in the final adjustment, adjusted budget was 1.5 billion, and the overall money which was available, therefore it was 190. But we also did indicate in terms of the non-personal services which they've underspent due to offline of the system, which is Lockit, was our financial year, and some of the reasons it will be those that the minister has indicated during the overview. The 6.1 million transferred to OHCS, and the remaining balance of 7.2 million, which was transferred to the CCMDT, cover some of the budget pressures. On the next slide, it's just indicating, Chair, I think what I already indicated, except the last point, which says, however, the major contributory to underspending, it was the non-personal services component, which it was on the Ideal Clinic and other components. So just move straight to the audits. On the audits, Chair, as a sector, we were having the 9 provinces and national. So the only provinces which were doing well in terms of the audit is the Western Cape, which you will realize they've been getting the unqualified, also followed by Gauteng. Gauteng, you'll see for the past 7 years, they're also receiving the unqualified audit. We're also having 2 provinces which seems to be improving in terms of the audit outcomes, because for the past 2-3 years, they've also been receiving the unqualified, which is Northwest and Mpumalanga, respectively. And in some of the provinces where they were also getting unqualified and going back to qualifications, which you realize those ones being the Eastern Cape, the Free State, and also the Limpopo. But with the exception of KZN and Northern Cape, which from the past they've been receiving the qualifications without the unqualified audit. So the next slide, it just indicates in terms of the national department, which I did not indicate, but it was included in the previous slide. To say for the past 10 years, or the past 10 years, we only started to receive this qualified audit opinion in the current financial year, which is the past, which we busy presenting. The issues there, it was as the minister had indicated, but Chair will also indicate as we move through the slides. Can we also move the slides? On the qualified audit opinion, so the qualification area relates to the limitation finding in accrued departmental revenue. So in easy terms, Chair, this was relating to the COVID-19 recoupment process. So the system implemented by management was not always adequate to ensure all transactions and events were accurately recorded in the financial statement. So some of the issues, it would be what the minister has indicated. So as we go through the slide, I will also indicate some of the adjustments, which therefore as a department we have to do as a result of that. On the next slide, in terms of the audits, we also indicate other matters which have been raised by the AG, which we had the material misstatements. We had managed to correct those during the audit, hence they are not part of the qualifications. So the first one, it was the capital work in progress. Here, it was the issue of the treatment, the accounting treatment in terms of the feasibility fees and the research expenditure from stage 1 and stage 2 of the project's implementation. However, we did do the consultation with the National Treasury and also AG, they've done their own. So there were misunderstanding, or we had different conclusions in terms of that. But however, we managed to resolve the issue by doing the adjustments in terms of accruals. Those were the administration fees from the private facilities, only from the COVID-19, because those recoupment process, it also involves the private facilities. So there were also accruals which were not accounted for. That's on the slide 67. If you're showing the slides, because I see some, they are not moving at the same time. Then in terms of the contingent asset of the 123.7 million, it was also the same relating to the vaccines in terms of the vaccines which were the actual vaccines which were in the hands of the private facilities. On the next slide, we also indicate the events after reporting date. In this one, Chair, it means we had the procurement process which was underway as we conclude our financial year. And then the projects were only appointed after financial year. However, we have not yet received such information from our implementing agents, which was DPSA and PUCA. Therefore, we had not included those as part of the commitments, and we have made such adjustments. In terms of irregular expenditure, and those were 61.4 million, but I'll indicate in the next slide. In terms of the same irregular expenditure, there were also prior errors, which 210 million was omitted to be included in the payables in the 2020 and 2021. So it was only the adjustment in our financial records. And also the inventory of 7.6 million, which it was the COVID, which there was just a duplicate in terms of the error included in the financial statements, which it was also further adjusted. As I've indicated on the irregular, fruitless and wasteful expenditure, it was 61.4 million. In the these ones, they were only relating to 2020-2021 financial year, which therefore the department was still doing the determination and ensure that they do the investigation processes, which by then we have not yet started. So those were the 8 cases. And those irregular expenditure was mainly due to non-compliance with the HCM prescribed payments towards the expired contracts and the non-verification of tax compliant. And during the reporting period, the 5 cases of fruitless and wasteful expenditure were also investigated and concluded, and there were no new cases for fruitless and wasteful expenditure reported in 2021-2022. The consequence management also relates to the irregular expenditure and the fruitless and wasteful. So in here, what the AG says, the department acknowledges that in some instances, investigations were delayed and due to COVID pandemic and the relocation of offices, as the minister have indicated. But however, some of those, the department has already started with the investigations, which therefore would include with the further processes. That's the next bullet point. In terms of the SCM non-compliance, this one, Chair, it's a non-compliance with regards to 30 days payment, as indicated in the National Treasury regulations. So we just only indicating the number or the value of invoices which were paid within 30 days and the ones which were paid outside 30 days, which in total it was 80.6 of invoices which were paid within 30 days. Currently, there are processes and the payment within the days, it has improved significantly. In terms of asset management, as required by Treasury Regulation 16A7.7, when we disposing any computer equipment, the department or all departments, they're supposed to consult the Department of Labor. In this regard, that consultation has not happened. However, that was the result of that paragraph within our audit report. So that relates to those computers which we are not using and because they were damaged from water and other incidences. On the quality of financial statements, currently, we're ensuring that all financial transactions which are recorded in our financial system and our financial statements, they are supported with verifiable source documents. We're also ensuring that all financial transactions are reconciled on daily, monthly basis as required by the PFMA and also the Treasury regulations. So all inputs, they have been received from the end users, and we're making sure that we're reviewing our financial records to ensure the accuracy of all the information we include in our financial statements. We further, Chair, in terms of the next slide, on the audit improvement strategy, we make sure that there is a proper record keeping. We processing and reconciling all those accounts that we're having within the department, as we have indicated. And also there is a regular, accurate and complete financial and performance reporting. We're also doing the compliance monitoring on continuous basis, and also some of the steps that we did from the qualification, it was to ensure that we develop the audit action plan, that it will guide us to make sure that we are able to resolve the issues that we're having. So currently, the only issue of qualification, it was the recoupment from the COVID-19 or the reimbursement process, which we have already, together with the AG, we requested that they do the interim audit, Chair, and we have also done the walkthrough with the AG in terms of that process so that we all understand the process. Then there is a quarterly reporting and identified findings as indicated. So we also have in that audit action plan that we're monitoring quarterly, submitting to Treasury as required. So just to also make sure that we reduce the number of issues or the number of misstatements which AG has identified in the previous financial year. We also have NDOH to provide an oversight role on the implementation of this action plan and reporting to make sure that all those issues comes this financial year, as we are currently with the AG doing the audit for the current financial year. Lastly, Chair, the strengthening of our internal control system, which is very important, because in details what it means, we're making sure that as we continue going forward, all the payments that we make, all those reconciliations that we do, there is the supporting documentation on continuous basis, also requesting internal audits to be able to do some of the responsibilities that will enable management to identify all those internal control deficiencies and come up with recommendations to improve their processes. Then therefore the improved processes will ensure or will reduce the minimum statements as AG will come, and actually any other stakeholders share, because we're not doing it for AG, but to ensure that our control environment is strong. So that was the last slide. So the other slides, am I not going to go through them, but actually it's just the further details in terms of the slides which I've already dealt with, in terms of the other grants or the other components within them. Within the grants which I've already presented. Thanks, Chair. I think that's where I will stop. So I'll take it back to DG.
Thanks, CFO. Before DG comes in, so that's the presentation, Chair. I'm going to ask that the Deputy Minister Lomo would facilitate to be the leader of the delegation towards, as we move from now to the end, and assisted by the DG. So back to DG, if there's anything to add before we hand over back to the chair, and from there onwards, the Deputy Minister will be from the department side. He will be the one guiding the DG and the team. But let's just check with the DG if there's anything to add.
No, thanks, Honorable Minister. Nothing to add on my side. We are ready for the chair and the honorable members.
So back to you, Chair, and over to Deputy Minister. As you raise the questions, he will lead the discussions as you take the questions. Thank you. Over to you, Chairperson.
Thank you, Honorable Minister and the health team. Indeed, your presentation and on what you did in the last financial year gives courage, particularly your interventions on what you call audit improvement strategies. They are giving hope that we will make it. And moreover, this department has a history of getting, unqualified audit for the past 10 years. And we understand why it happened this time and how we are going to overcome that. It does put a smile on our faces that the health of our people is definitely in good hands. I just want to check, Honorable Minister, the department is working on reducing medical legal claims and prevent medical legal claims from arising. And why should they arise in the first place? And what I want to know is, has any progress been made against legal firms and individuals that institute fraudulent claims against the department? It's been in the media for quite some time in the last few days. And have those officials in the department who are seen to have assisted the fraudulent claims, have they been charged? What kind of action was taken against them? And I want to check again now there'd been stories of fake doctors in our hospital. How can we link some of these claims, either fraudulent or even those medical claims because of negligent or other reasons? How much can we attribute that to fake doctors? And in our system, how long does it take for us to unmask a fake doctor? The other thing I'd like to know again is we have an acting CFO. When are we going to appoint a CFO to ensure that we have a, when you have a permanent job, you can dedicate all your life and time to it. But acting really, how long are we going how long is it going to take us to appoint a permanent CFO? Honorable members, the discussion is open. I see the hand of Honorable Christian. Yeah, Honorable Christians, the floor is yours.
Thank you, Chairperson. I have a few questions. With regards to Program 1, I see that the target for the provincial departments to receive clean audits have been removed. Now, my question is, what is being done to improve the audit outcomes to clean audits, and what support is being provided for the provinces? And this especially in terms of the Northern Cape province, who hasn't received a qualified audit since 2011. Now, what is the department doing to assist poor performing provinces like the Northern Cape? Also considering the backlogs in surgeries. Again, I'm referring to the Northern Cape and to the hospital in Kimberley, the Robert Sobukwe Hospital. The backlog is extremely high with regard to life-threatening surgeries. Now, how is the department addressing all of this, receiving clean audits and getting these backlogs addressed as soon as possible? And then with regard to the medical legal cases, I also have a question with regard to that. Now, it has been mentioned in the report that this is due to poor administration, specifically where there are no files or where documentation cannot be found. Now, what is the department doing to address this poor administration in hospitals? And then the vacancy rate was displayed on the screen as being 16.9%, 1,696 as a vacancy rate. And again, I want to address things like the backlogs in surgeries. How is this vacancy rate being addressed so that we can address backlogs in surgeries and other poor administrative dealings in provinces? And then with regard to Program 2, now I see there that as was in the case in the previous financial year, despite a reduction in the budget allocation, spending levels have declined compared to the previous financial year, with an even greater underspending in this program. Now, what is the reason for this significant underspending, and what is being done to address this issue? Then in Program 3, what health promotion interventions is the department implementing with regard to antenatal care? And I'm specifically referring here to rural areas, what is being done there. And then with regard to the prevention of mother-to-child transmission for the period under review. Now, what are the key lessons that have been learned during the implementation of this program? And more especially, I think, what we are looking towards is the total eradication of mother-to-child transmission. Now, when is the department envisioning to achieve that end goal in mother-to-child transmission? And then with regard to TB, now during the COVID-19 pandemic, obviously services were affected like TB and HIV, etc. Now, what has been done to get the people back, those that have defaulted in their treatment? How many tests have been done in this particular financial year? And how has contact tracing been affected, especially during the COVID-19 pandemic? And then another concerning issue is the out of stocks, ARVs, again, TB drugs, drugs that are really relevant and very concerning, especially in provinces and especially in rural areas. Now, these out of stocks, what is being done like the ARVs and the TB drugs, they are obviously of the 12 non-negotiables. Now, how is the department planning to address this challenge, as many hospitals and many patients have been complaining that, facilities have reported that they are out of stock? And then another concerning issue, and what is the department's collaboration with higher education and perhaps also basic education? What is being done to address the high levels of teenage pregnancy in the country? And then I just have a few questions with regard to the expenditure. Now, is the department playing any role in addressing the high levels of irregular expenditure, especially within provincial departments? This has obviously increased over a number of years, and a few of the provinces that I can mention is the Northern Cape, the Northwest, etc. And yet some of these provinces record underspent amounts in a few of their programs. Can the department elaborate a little bit on that? And then also, can the department provide an explanation of the fruitless and wasteful expenditure incurred? And has any officials, has any action been taken against any of the officials? And what is being done to prevent this in the future? Now, the AG also noted material findings in the health sector on usefulness and reliability of performance information. Now, the data reported by the department has its weaknesses and performance information, and it says that it may not be reliable or accurate. Bearing in mind that this is one of the recurring issues that the department has been experiencing over a number of years, how is the department and the health sector going to address this, not only in the long term, but also in the short term? And then lastly, Chairperson, if the department can please provide to us the details with regard to the 49.7 million recorded as irregular expenditure, the 30.6 million recoverable, and the 19.2 million awaiting authorization. If they can just give us a brief details on that particular irregular expenditure that has been also documented there. Thank you very much, Chairperson.
Thanks, Honorable Christian. It will also be, you wanted to know what is the department, how is the department going to address the vacancy rate? The vacancy rate, I'm told, is 16.9% or 16%. And how are we going to close that gap? My other question would be the targets that we set ourselves as the department, that this is our performance area, and we end up not achieving those. What happens to the people who are responsible for those targets, for failing to achieve the targets, that the goals that they've set themselves? We have Honorable Luthuli on the platform. Honorable Luthuli, you'll be followed by Honorable Tumele Nzube, in that order.
Thank you, Chairperson, and greetings to everyone. Chairperson, I would like to ask the department how many unemployed graduates and interns is the department hired. Also, I would like an update on the use of finance interns in the department and in the provinces. Chairperson, most of the questions have been covered, especially the one on expenditures and also the findings of AG. I also wanted to ask those ones. But Chairperson, maybe my last question will be, yes, oh, sorry, Chairperson.
Yeah, you got cut off, kind of. But you repeat your question again.
Okay,
Thank you.
I also want to know how are the officials held accountable for not achieving their targets. And lastly, Chairperson, how is the department addressing the vacancies rate of 16.9 against 10% target. Thank you.
Can I come in, Chair?
Yes, Honorable Ncube, you may come. It's your turn.
Okay, no, thank you very much, Chairperson. Let me greet the Minister and Deputy Minister and the entire ministry. Let's welcome the comprehensive report that we just received now, Chair. I think I've been largely covered by the previous speakers, Chairperson. Just to say, Chair, that as a note, Chair, to the department, that there should be a focus, Chair, a specific focus that is there should be a focus, Chair, particularly there's a hospital here in Free State, Chair, Bloemfontein, called Pilinomi, and then there's another one called Manapo Mupedi in Kwaku. From what we are seeing, Chair, the hospitals are neglected. They do not discharge their own missions that they should, Chair. You find that patients wait more than 24 hours before they can be assisted. Others even die at the seat they're sitting without being helped, Chair. So we'd just like to urge the ministry to really capacitate these particular hospitals that I'm referring to, Pilinomi and Manapo Mupedi in Kwaku. And secondly, Chair, I think in two specific hospitals that I've just mentioned, there were vacancies, Chair. So I would just appreciate if the minister could push those who are responsible to fill in the vacancies so that we can increase the capacity of the nurses and the doctors and all the personal staff that the hospitals will be in need of. Thirdly, Chair, I would just like to say, Chair, we should pay a specific attention also to the raising alarm of HIV and AIDS, and say, Chair, that with the same efforts, with the same energy we dealt with COVID-19, we should deal with this all other diseases such as TB and HIV and AIDS. And in conclusion, Chair, I just want to check, Chair, because we do not know what will happen tomorrow, Chair. What is it that the department are putting in place as a measure to deal with maybe another pandemic that may come, Chair? And just as an advice, don't you think that it's time that the state has its own the state manufacture its own vaccines so that we can capacitate ourselves so that we can deliver and deal with the healthcare of our people? Thank you very much, Chairperson.
No, thanks, Honorable Ncube, particularly for your last question. Just to make a little addition to that, how are you working, and what are the relationship between you as the Department of Health and the Department of Science and Innovation, and tertiary education, of course, in the in formulating strategies, for instance, to have vaccines produced at home here, ARVs and TB medication? Don't we have the capacity in the country to do that? Or are we still, buying our medication from outside? I think I'll give this time, if there are no members who want to ask questions, I'll give over to the ministry to respond to some of the questions.
Chairperson. Chair, it's Baha here.
Honorable Baha, yes.
Yes, thank you, Chair. Chair, I was.
Sorry, Chair. And me too, Dongeni. Sorry about the disturbance.
So it will
Thank
be
you, Chair.
Honorable
Yes.
Baha followed by Honorable Ndongeni.
Yes, thank you, Chairperson. Chair, I'm in and out because of load shedding. And now, I don't know, maybe I might repeat something that was covered or something that was asked by other members. But let me go ahead, Chair, to say for the past 10 years, the department had received unqualified audits, and now it's a qualified audit outcome. What is the cause of the regression to qualified audit outcomes, and when, how, and when will this be able to be improved? The second one, Chairperson, is on the Cuban doctors. How many Cuban doctors were brought in to tackle COVID-19, and how many remain, and how much is it costing the department? And the last one, Chairperson, is we've seen Gauteng, we've seen the Western Cape departments that they've had unqualified audits or clean audits, so to speak. And so the entities as well, like the South African Medical Research Council, who consistently achieve clean audits. Now, what I want to check, Chairperson, is what is the department doing to ensure that we lift others up so that we are able to get clean audits across the board? Thank you, Chairperson.
Honorable Ndongeni, it's your.
Okay. Afternoon, Chair. Good afternoon, Minister, Deputy Minister, members, and the staff. I'm sorry to be late, but I have these questions. I'm not quite sure whether my colleagues have been asked. The department should provide a report to the committee on the state of negligent medical services in the country. Maybe they don't have the report just now. If they can provide, whether it's next week, it should be better. The second one, how has the department improved its surveillance of food safety given the 2017 outbreak of listeriosis in the country? Is there still difficulty in dealing with the other departments such as agriculture? How many ideal clinics have been certified by the Office of Health Standard Compliance? Why is there such a big discrepancy between peer review and OHSC inspection? Given the high rate of sexual crimes in the country, have province submitted quarterly reports relating to the management of sexual and related offences? How many health facilities are designated to render services for the management of sexual and related offences in the country? And what role is the department playing in the fight against gender-based violence? Thank you, Chairperson.
Thank you, Honorable Ndongeni. Is there another member who wants to ask a question or comment?
Chairperson, if possible, can I have just a quick question?
Yeah, you can have a second bite, and that will be the last question. And then we'll give over to the department to respond.
Thank you very much. Thanks, Chairperson. I just have one question. I just want to know about the Cuban doctors that were brought in during the COVID-19 lockdown. I just want to know how many of them still remain in the country, and how much it costs the country, and how much it will still cost the country if they are still in the country. Thank you, Chairperson.
Yeah, we can hear that some of the questions were asked, and those who will respond, you know that these are issues that are in the minds of members, and we will definitely need, to be briefed on this. And in instances where we run out of time and there's no information, the information can still be put on paper and then sent to Marcel, our committee secretary, and then it will be given to the members. Let me give over to the ministry to respond to the.
Thank you very much, Honorable Chair, and the members with the questions that they've posed. I would just comment on a few and request that most of the questions asked by Honorable Christians be looked into by DG or allocated to other managers. I'll touch a bit on the questions asked by Honorable Tsubi. Honorable Lutuli, DG, if you could also attend to that. But I'll touch base on the issues of Honorable Baha, and I was not able to hear well, except for GBV, what the department is doing on the GBV from Honorable Ndongeni. There was a bit of a background behind where she was. With the Honorable the Chair, you asked how long are we going to continue having an acting CFO? We don't have an acting CFO as a department. We have a CFO as from October 2022. So the gentleman who was presenting here is a CFO employed by the department since October. So we don't have that position acting anymore.
Oh, thanks.
On the issues of the backlog, Honorable Christians, we did mention this in the past presentations that because of COVID, there were certain operations that were kept and delayed because we were dealing with emergencies and therefore during the COVID. And there was a bit of a backlog countrywide that we are now dealing with. We might actually accede to the issue that there are certain provinces or hospitals that might have done better and quicker on the backlogs. And maybe the DG will emphasize if there's been a complete eradication of the backlogs on that one. Related to that, Honorable Tsubi, we were also, because of COVID, had certain programs that we did not really push as fast and as hard as we were doing. One of them was TB outreaches and treatment and also HIV and other programs. And therefore, when we had a strategic plan together with the TB conference last year, we then developed what we call TB HIV recovery plan, with the understanding that there are certain programs that were delayed or kept in abeyance because of being overwhelmed by COVID. We are really now picking up, we are accelerating programs of TB programs of HIV, maternal and women's health, including childhood health diseases. As you would be aware, we've just picked up that there's measles in the country. There's been a very strong campaign vaccinating against measles. Again, we now have space and time to deal with other programs in the country. So there are recovery plans and programs that we are dealing with. The honorable members might probably not be aware of programs. The DG would please touch on this, on our pandemic preparedness for the future. When President Ramaphosa stopped the chairpersonship of AU, the AU requested him to run on behalf of AU programs to say, can we begin to prioritize Africa in terms of vaccine development and other future pandemics, including manufacturing of certain medicines. Now, there's been a lot of visits from AU and other countries to go and visit Gqeberha, to visit Western Cape, where we already have manufacturing plants in those areas. Of course, we would benefit as health. The lead department is the Department of Science and Innovation. So there's been quite a lot that has been done. Maybe members have not been following those programs that are going all over the country. Not only are we going to become a hub for South Africa, but we then become a hub for the continent in terms of those vaccine programs. I would have probably loved to say over and above what the DG, I don't know if he's got numbers to answer, how many doctors came in from Cuba, how many are still left, how much did it cost? If members were to also ask, did we think we had a value add from the visits from the Cuban doctors? Was my answer would be said, yes, of course, yes. Developed countries, Italy, all countries in Europe would not have managed the pandemic of COVID the way they did if they did not ask for the visit, for the brigade from Cuba. Not only did we benefit as South Africa, but the whole world. This is a country that has got a group of doctors who are trained as epidemiologists, focusing on primary care. So if we were just not being modest, we should be saying the people who contributed, the expertise that contributed to saving the world from COVID was the Cuban doctors worldwide, not only just South Africa. Yes, maybe then we can indicate to you how much it costs to do that. But maybe other people think that the cost of life is just not going to be counted in terms of rents, but in terms of saving those mothers and fathers who otherwise would have died and leave orphans around. But maybe DG, you can then deal with these very technical ones regarding the unqualified audit. Oh, by the way, the DG should, Honorable Bacher, you probably joined in late. The minister alluded on this, but please say it again, DG, that we got a qualified audit just on one item because of our hard work that we put in for the COVID-19. Hence, we were qualified on that. Otherwise, there were no other issues that were found on that process. DG, maybe let me give it to you to allocate to other members or yourself leading us in terms of responses. Thank you.
Thank you very much, Honorable Deputy Minister, and thank you, Chair and honorable members. I will deal with a few questions and then I will mention which members of the team will respond to a number of questions. I won't cover those that have been covered by the Honorable Deputy Minister. Maybe because the Deputy Minister spoke on the issue of the Cuban doctors. During the pandemic, of course, not downplaying the importance of the role that they played. We had 187 Cuban doctors that came into to assist us in different provinces. And most of them have now gone back to Cuba, and the remaining 67, mostly in Limpopo, at the request of the province. Their contracts are ending at the end of April. We will request that we be given a chance to go and get the proper costs of how much it cost, but that is where we are. The honorable members will recall that not only with the Cuban doctors, even with all the other staff members that we brought in during COVID, because they came into the system that was already quite lean in terms of staff. They came in and filled a huge void. So there has been reluctance to let those people go, inclusive of the Cuban doctors and also our local people. But the current cohort that is left of 67 out of 187, the contracts are ending at the end of April. The second issue I would like to talk to, the minister explained this one very well, was that we were managing COVID over since 2020, including the reporting period. And one of the key issues that we needed to deal with was, besides the prevention of COVID and other matters we had to, and managing the patients, we had to implement the large-scale vaccination program in South Africa. And one of the key issues of that program was that we were the only procurers of the vaccine as government. So we were actually coordinating for both the public and the private sector. And for us to do that, we needed to put up a mechanism in place to ensure that, one, people do not get disadvantaged because they are not insured. So we came up with a system where a private sector was vaccinating both insured and uninsured patients. And for insured patients, their medical aids had to pay for that. For uninsured patients, we took the tab as the public health sector. Similarly, the public health sector had to also do the same. That is, look after both the insured and the uninsured. And in looking after the insured ones, we needed to ensure that those who have insurance were able to claim from the medical aid schemes. Now, working on that, we needed to then develop a system of how do we actually get that money back from the medical schemes for the public health sector where we would have given those people the vaccines. It took a bit of time to start that system, but I must also mention that our priority was to get as many people as possible vaccinated so that we mitigate the impact of the COVID vaccination. So ultimately we developed that system, and numbers were worked together based on the information that was provided by the people and the medical aids that were provided. So based on that, when we did our financial statements, we had we had figures of the money that we expected that we'll be able to collect from the medical schemes based on the information that we have. We all know that the medical scheme industry is quite a tricky one. I mean, doctors even today and anytime complain day in and day out that some of their claims are not are actually dishonored by the medical aid schemes. So when the Auditor General came in, they look at what we had put in our financial statements as the expected income or the receivables of what we'll get from medical schemes. Then they did a sample and did the testing. When they did that testing, then they picked up that some of those people probably would have given us, and medical schemes are quite labile. They couldn't pick up that if we're going to get that money. Then they said, look, this money you've put in here, you are not guaranteed actually that you are actually going to get this money. This is our testing that we have done, and we could not actually see that you'll get this money. That's where the qualification came from. And so that's why the minister was trying to explain that that's the issue. One, as a department, our priority was to save lives, and we are very happy that I think we managed to save some lives and got as many South Africans vaccinated as much as possible. But whilst doing that, then the accounting processes let us down. Hence, we're working on that. However, as the CFO has mentioned, he will come in at a later stage. There's been a lot of work with the Auditor General to try and actually address this matter and actually improve our audit outcome to where we were for the past number of years. That is what we've been working on. I think the third issue I would like to talk to is the issue of medical legal cases. Yes, it is true. It is one major area that our minister, most of the time, whenever we have our meeting, he raises concerns of the issue of medical legal claims that we have in different facilities. And yes, what we've done as a department, specifically to address the honorable member, was that we had appointed a number of firms that were doing some investigation at a central level, but working with different provinces to actually look at a number of areas in terms of the claim, including some forensic work. They've done that work now and they've got information. What has then has since happened was that then the president then put up a proclamation for the special investigation unit to start looking into this work, so that these firms then have to submit this information to the SIU so that proper processes could then be followed for any fraudulent claims. Now, this process is now at the hands of the SIU, and we hope that we are going to start seeing some action from that side. The SIU did come to present to all the HODs, and they have been linked with the different firms that are working with us to actually look into these different claims, whether they are fraudulent or not fraudulent. However, we must mention that besides the claims being fraudulent and non-fraudulent, there's still a lot of work that we're working on. I think one that has been mentioned, that is the issue of the administration, the management of records. We're looking at long-term solutions like the introduction of digital health records, which now will be very difficult to steal, because what happens is that files end up missing, and we believe there might be collusion with our own staff members. And we believe that the forensic work that has been done might be able to unearth those culprits, and then they'll be able to face the consequences. But we continue doing our best, working with provinces to ensure that we actually prevent these incidents that end up being in the medical legal space and then milking the department out of money. On the issue of unmasking the fake doctors, this is a dual process that, of course, as a department, we work closely with the Health Professions Council of South Africa. For us to employ any doctor to work in our facilities, that doctor must actually have a license to practice from the Health Professions Council of South Africa. So if they present that license to us and it is authentic, because some of them, they do get fraudulently registered with the council, it becomes very difficult But most of the time, I think the council is also working very hard to tighten the processes to ensure that everyone who claims to be a medical doctor is actually a medical doctor and is registered through their own QA processes that they are putting in place. In addition, without only looking at the employment, every year, every professional who is supposed to have a license to practice must actually produce the renewal of that license to ensure that they are continuously registered. Because if you haven't paid for your license, like I'm due to pay for my license, though I'm not practicing, I'm due to pay for my license end of this month. If I don't pay, I'll be kicked out of the register. And it becomes a problem. So that's what happens in facilities. That's a function of all the human resource managers in the different practices that are there. I think the next one that I would like to touch on before I hand over to my colleagues is our relationship with the Department of Science and Innovation. We actually have quite a very good symbiotic relationship with the Department of Science and Innovation, working on all the local manufacturing of the vaccines and the number of areas. And we have a working team where we sit in through our different officials, working on all the modalities, the work at BioVac, and the other areas. We've been really been closely involved with this kind of work. But we'll also notice that actually, even in some of this work, some of the people, the scientists that are involved are actually employed by our own state entities, including the likes of Professor Glenda Gray, who's the president of the MRC. So there is that symbiotic relationship. And yes, of course, it is actually our vision as a country that we should not be dependent on external manufacturing. So we should be able to respond quickly to our using our own internal mechanisms to deal with any epidemics. We do have actually the lessons that we've learned and have set up systems to be able to deal with the future epidemics as we move forward. The next question that I would like to deal with before I hand over is there's a question from Honorable Lutuli in terms of unemployed interns and probably graduates. Firstly, as a department, we always meet our statutory obligation. As a state, there are two obligations that we have in terms of the doctors. Doctors who've just finished, they do a 2-year internship. That is a statutory obligations. And if they meet all the requirements, we are able to appoint those people into the posts in different provinces. And even in this current financial year, we've been able to get all of them into positions. When they finish the 2-year statutory internship, they have 1 more year statutory community service. Again, as we talk in this financial year, we're able to place all those doctors for statutory community service. At the end of statutory community service, then those doctors are eligible for registration for independent practice with the council, meaning that if they want to go to the private practice, they'll go to the private practice. If they still want to stay in the state, they must compete for positions that are available, that are advertised by provinces. So it's no longer the matter of placement, but it's a matter of actually seeking employment. They may apply for a job at Netcare, they may apply for a job, they may open their own private practice, they may go into academia. So, but we still actually through provinces, when they advertise positions, we encourage that doctors come in because we need them to actually ensure that the public service is actually well staffed. It's not really the matter of placement after. So those 3 years, the 2 years internship and the community service, we do actually have an obligation as a state, and we always go all out to ensure that they are properly placed, provided obviously they meet the particular requirements as mentioned. There's a number of students who are even foreign who do medicine in South Africa, and there is a rule in terms of that, whether they can actually do internship here in South Africa. So those obviously are treated separately. On that note, Honorable Chair, I would like to request that I hand over to the CFO to actually deal with the matters around the expenditure. matters around all the questions around the audit, the regular expenditure, the fruitless and wasteful expenditure, and the issues of consequence management. As soon as he is done, I'll request Dr. Crisp to talk specifically on underspending on Program 2 on the NHI, and this is the bill that is currently in the parliamentary process. But I'd like him to come in and address that. Thereafter, I will request Mr. Murawane to deal with issues around HIV, TB. Though the Deputy Minister has covered most of them, if there are any specific issues, that's including the management of survivors of sexual assault and the facilities that are designated to deal with the survivors of sexual assault. He will deal with all those matters as he comes in. So let me hand over to the CFO, Mr. Mamokgale, over to you.
Thanks, DG. I will go through the questions. I have grouped them in terms of the questions in audit, and also the second group is the irregular and fruitless and wasteful expenditure. So when I start with the audit, DG, I'm not gonna repeat what we have said together with the Deputy Minister, but just to indicate on the amount which was doubtful from AG that we'll receive as the department, I think on our slide number 8, it does indicate that we have received 1.3 billion so far in terms of that process. So it was beneficial to the department, but also in terms of the question of what are we currently doing to ensure that we can move to the unqualified audit again. I've also touched on it during the presentation that we have requested AG to start conducting the interim audit, which they are still busy, it's still in progress. And I can also indicate on the 1st of March, together with the AG, we were on the process where we were doing the testing process in terms of this recoupment process, just to ensure that we are on the same picture. So in terms of that, DG, because there was a question of when are we anticipating to go back to the unqualified. So the answer, it would be, it's in the current financial year. While still on the audit, there was also questions regarding the support to the provinces, and also the question on removing the targets from the provinces in terms of the performance in Program 1. So in the past, we had the project which was called SAICA project, funded by National. So therefore, the National has sent the CAs to the provinces just to assist the CFOs. Then in those years, hence then the process, because National had a direct input, then that target was included within our annual plan. But however, even though it's been removed, DG, I can also indicate that as a national department, we're also having 10 by 10 with the AG, with an aim of improving the audit outcomes, just to ensure that there is no inconsistencies in terms of the processes. We also having the CFO forum, and also a subcommittee to the CFO forum, which is the SCM committee. So in those, we discuss all the issues from the AG. Then we also provided the technical support or guidance to the provinces to ensure that we can improve in terms of the audit outcomes. In terms of the irregular expenditure and the fruitless, because what we indicated in the presentation, it was 64 million. But then, however, I can indicate that the total irregular expenditure for the national department is sitting on 359 million, of which 150 million was already investigated and disciplinary actions were done. And then we're only awaiting for the condonement process. And we can also identify the 100 million which was investigated, which was also submitted to Treasury for condonement in the past. And we also having the other transactions which accounting officer has delegated the internal audit to conduct the investigations. So those reports, they will be finalized this month. Then in terms of the processes, we should also cover some of the questions of what are the plans. Because in terms of the processes from the Treasury regulations, it's that after we identified these irregular expenditures, we must investigate, which is an important part of the process which we must start with. So as we investigate, we identify all those issues, then we are able to implement the disciplinary processes, as I've indicated in terms of the amounts, that there were some disciplinary processes which already took place. And when we're done, then we'll be able to improve our control environment, because that is the one requirement from Treasury to be able to approve or to condone all those transactions. Then when we're done, DG, we're going to be busy then finalizing the condonement process, which we must request from National Treasury. And then when we have received that, then we'll be able to reduce this irregular expenditure within our financial records. I think I have covered more especially the questions on the audit and irregular expenditure, but I also have Andre on the call, DG, if maybe you would like to add some of the, or make an input to the response. Thanks.
No, thank you very much. Thank you very much, CFO. Andre, do you want to add anything?
Good afternoon, DG. Afternoon, Honourable Chairperson. Not really much. CFO did cover everything, just on the fruitless and wasteful expenditure, Chair. If I may indicate that the amount is 1.5 million rands for fruitless and wasteful expenditure. And that is historical fruitless and wasteful expenditures. Due to circumstances, we could not finalize those investigations. However, in the current financial year, we have made huge progress on those, and that will be addressed when we've compiled our financial statements for the current financial year. I think that's from the question, Chair, those are all. Just to repeat again, we do have the CFO forum, and through the CFO Health Forum, that is where we guide and give support to provinces and also monitor the irregular expenditures. Unfortunately, irregular expenditures is not always due to fraud and corruption. It is a compliance issue. So for example, if there is no tax or valid tax certificate, then that is declared as irregular expenditure. So those matters are being attended to, and we are improving processes to ensure that we do not attract those irregular expenditures purely because we did not comply with the requirements of the procurement frameworks. Chair, let me stop there. Thank you very much, DG.
Thank you very much, Andre. My apologies, Chair and honorable members, for not introducing Andre. Andre was the acting CFO before the appointment of the CFO, and the report being presented was during his tenure as the acting CFO. Thank you very much, Chair. May I invite Professor Crisp to come in on program 2? Professor Crisp.
Thank you, DG. Good afternoon, Honourable Chair, Honourable Members, Honourable Minister, and Honourable DM colleagues. So I think what we need to say about Program 2 is that it is an evolving. The National Health Insurance itself, as everyone is aware, doesn't exist yet. This program was a combined program of NHI and the Chief Operating Officer until the past year. And there's been a process of unbundling the program, and the Chief Operating Officer position was abolished. And some of the staff that were part of Program 2 are being accommodated into other programs in the department. And not all of that unbundling and reorganization has taken place yet. So in program management in particular, there have been vacant posts created as a result of some of this reorganizing. In affordable medicine, some of the hardware was not purchased during the financial year in question. And partly that is because we are busy reorganizing all the digital systems in the department to prepare for National Health Insurance. And we have spent time consolidating both the hardware and the programs to make sure that we're not duplicating systems and that the platform for National Health Insurance is being created. So there were some temporary savings while we reposition ourselves in affordable medicines. As far as health financing and National Health Insurance is concerned, this again, there were various components that have moved out of this program into Program 1 administration, where we were the revenue was being administered in Program 2 before, but it is now moved into Program 1 as an administrative matter. The expenditure that was created, or the budget that was created for in this objective, is to cater for the new chief directorates, which are being created in the Department of Health to prepare for national health insurance. As I've said, this is a branch. We are not creating the national health insurance itself yet. We are in the process of preparing those activities which are needed as foundations for the national health insurance. Now, 44 posts were approved by the Department of Public Service and Administration and the Honourable Minister, and funds were created for the establishment of those posts. But since they've been advertised, none has yet been filled because the process has been long. There were 1,955 applications. Many of them do not qualify, and we've had to re-advertise for several of the posts. So that process is not completed, but we're confident that we are building the capability, and from the coming financial year in April, things are beginning to look like they are taking shape to be able to prepare for national health insurance. I'll leave it at that. Thank you, DG.
Thank you, Prof. May I invite Reverend Morewane to talk on issues of Program 3?
Good afternoon, DG. Thank you very much, and greetings to the Honorable Minister, Honorable Deputy Minister, and the Honorable Chair, and all honorable members on the call, and my colleagues in the Department of Health. Honorable Chair, I have a number of questions, or rather a few questions with a number of answers. But thanks very much for the Honorable Deputy Minister for having dealt with some of them. With regard to the prevention of mother-to-child transmission, particularly the education of pregnant mothers, I must say that luckily, both programs fall under one DDG, which is HIV and AIDS and maternal health. And the program of the prevention of mother-to-child transmission falls within what we would call pregnancy education. Whenever mothers are pregnant, when they first enroll for ANC, they are then informed about the availability of the prevention to mother-to-child transmission regime, and then they are enrolled straight away. And they are therefore encouraged not to default on taking of the treatment until and beyond that, after the delivery of the baby, and including up to during breastfeeding. So in that regard, we are of the view that if mothers adhere to prevention of mother-to-child transmission, indeed, there's very minimal chance of transmission of the HIV virus to the unborn baby. With regard to the TB program, to date, for the current financial year, we have conducted 1,980,771 tests, both using our own GeneXpert and ordinary lab testing. With regard to what we're doing around the recovering or improving performance following the decline in numbers as a result of our effort to cap or control the spread of COVID-19, the Department of Health then worked on the TB recovery plan, which is really grounded on 4 main pillars. We would want to go out there to find people with undiagnosed TB that are lying in our communities. The second pillar is that we want to strengthen the linkage of people that are diagnosed with TB, link them to treatment. And then the third pillar is that once we have linked them to treatment, we then need to make sure that we retain those people in the treatment care, in the TB care. And the last pillar is that we want to strengthen TB prevention efforts, both in our facilities, but also working together with our stakeholders. With regard to the teenage pregnancy, collaborating with the Department of Basic Education, Department and Higher Education, Higher Health, which is in the Department of Higher Education, we've got an ongoing program of sexuality and reproductive health program that goes through all these programs, but with in particular to the Department of Basic Education, we intensify our effort working through the school health programs, again strengthening our pregnancy education at schools, but also working in the higher health sector. We also have a program of establishment of youth zones in our health facilities, because we are aware that younger people would want to visit facilities at a point where they're very comfortable and they are not very scared to be seen by their parents or anybody who else who's the more of the senior age grouping. The question was raised as to what are we doing with regard to the TB and HIV and AIDS? Can't we employ the same effort and energy that we employed during COVID-19 pandemic? We're saying, one, we have a program called the intensification of welcome back strategy. For those people that were on HIV/AIDS program who fell by the wayside as we're focusing on COVID-19 response, we have that program. We're also going through with the implementation of the 3 multi-month dispensing program, which would allow HIV/AIDS patients to take their treatment for 3 months, so that they don't have to be going to the facilities every month to go and collect their treatment. We are also part of the Global AIDS Alliance, which is aimed at ending AIDS in children in 2030. So this is a global activity, and we're very hard at work to ensure that we want to eliminate HIV in children in 2030. We are also working together with the civil society to focus on the key population. And we're definitely going to start with the people living with HIV, working with people with men that are having sex with men and all other key populations to make sure that we pull them into care. And we've got the National Strategic Plan for HIV and AIDS that has just been approved, and we are going to be launching it very soon. We're working together with everybody, with all the provinces, to accelerate our performance with regard to 1990 as we're transitioning to 95. And so far, we've been able to identify majority of the health facilities that are pulling us down with regard to the second 90. And we've identified that 75 of these facilities are in our 4 big metros. And we're working with those metros to make sure that we're able to identify those people and bring them to care. And with regard to the management of the survivors of sexual assault, we've got an intensive program of post-exposure prophylaxis, which is a program that we're implementing in our facilities, and our people are educated about this so that whenever they've been exposed to sexual assault, they can access these services in our health facilities. And of course, there are Tutusela centers in some of the areas where our people can access these services, working together with the various sex stakeholders, such as the law enforcement agencies. Yeah, the DG and the minister and the deputy minister and the chair, I think this is where my response will end, but I'll be able to come back if there's any areas that I've left uncovered. Thank you very much, DG, and over to you.
Thanks, Reverend. The last one will be Ms. Hunter, our DDG for PHC. There's one specific question on ideal clinics and the OHSC. Over to you, Ms. Hunter.
Thank you, DG. Good afternoon to the Honorable Chair, Honorable Minister, Honorable Deputy Minister, the Honorable members of the NCOP and my colleagues at the National Department of Health. Honorable Chair, in the department, we do not keep the records from the Office of Health Standards Compliance as per the number of facilities that they have found compliant, because they are at the stage where they are still sampling the facilities. Their sample sizes are small, and therefore the numbers that they come up with is not statistically valid in terms of our total facilities in the country. The method that we currently employ to have confidence in our number of ideal clinics is the peer reviews, where you have cross-district reviews of facilities towards the end of every financial year. And through those peer reviews, we have established that at the end of this financial year that we are reporting on, we had 1,928 ideal clinics, and that makes up 55.61%. Incidentally, during this year, because of all the work the provinces were doing on COVID-19, the numbers took a dip. But in the subsequent years, the numbers are already increasing again in terms of ideal clinics. Thank you, Chairperson. Thank you, DG.
Thank you very much, colleagues. I will hand back to the Honorable Deputy Minister. I don't know if we've missed any, but I tried to capture as much as possible. Over to you, Mr. Dinangwe.
No, I think on our side, we have covered, thank you very much, DT, with the team that we have led. We have covered almost every question, unless guided by the chair, that were asked from us to really comment on. Over, back to you, Chairperson.
Thanks, GM, and thanks, honorable members. Thanks for the elaborate answers you were given to the questions. And like I said earlier, if there are issues where members feel that they need more information, our line of communication were never closed. We can still make those follow-ups and get the details in writing. Marcel?
Yes, Chairperson.
Yes, Marcel. Will you take us through the announcements for the next meetings and
Yes, Chair,
Well,
just
Chair,
to
can you log off
sorry.
now, Chair?
is that Baha, Honorable Baha?
No, Chair, I was just checking whether we can now be released as a department from the platform, but we will not do that until we get a permission from you. Over to you, Chair.
Just for the announcement, because I think it's going to affect all of us in terms of meetings. And then after that, you could be released, and then we'll deal with minutes of the last meeting.
Okay.
Thank you, Chair. Just to inform the committee that next week, Tuesday, is a public holiday. There will be no committee meeting, and the week thereafter, Chair, there is a chair of chairpersons workshop for the NA and NCLP chairpersons. Our meeting for that week also, Chair, will not take place. So in fact, this is our last meeting, and we don't have any minutes to adopt today, Chair. Thank you.
Thanks, Hera. This meeting is adjourned. Thank you very much.
Thank you very much, Chair. Thanks to
Thank you, Chair.
Thank you, Chair. Bye.
They're useless.
Thank you, baby.